Hello, and welcome to the Hormone Genius podcast. Today, we are going to be discussing a really important topic, and it's one that has been on my heart for a long time to bring up. And it's something that affects a lot of women, and I know this is going to be an important educational topic for so many women who are experiencing this condition. So today, Jamie, we're going to be discussing infertility. And we're going to dive in kind of at the surface level in many ways, just to kind of start the conversation, because we know that this word infertility is big. And underneath that is just a lot of layers of science, of education, of symptoms. So we're going to start kind of opening up a discussion about this and trying to give you a starting place for how do I even bridge this word and how do I go forward if I'm suffering from this condition myself.
Totally. And Teresa, I can just say, it's so, I don't know, just heartbreaking, or it's hard sometimes to hear somebody say that they have infertility. Like it's something that is, I don't know, something that they have. I don't like that word, have infertility, because what I think a lot of people don't realize is that infertility is not a disease. It's the symptom of something that's not, functioning correctly. And so, for the most part, of course, there are things that we know that will definitely cause infertility. If I don't have my uterus, that would cause infertility, but the cause of it is no uterus, for instance. But there are so many women who struggle, with infertility, and it's because of a disordered something that might be going wrong in terms of their physical body. And so I don't think that as a society, we're doing women any favors who are struggling with that symptom of infertility by not digging down there and figuring out the cause of that infertility. Right. And also just knowing there's something almost, I don't know, relieving that I always see on women's face when I say, just, you don't have infertility, like the infertility is a condition. That's the symptom of something going on, and we're going to get to the root of that thing. And I instantly see relief spread across that person's face. It's like they know that they're not labeled with like they're burning it into the skin or something that people can just notice by looking at them. You know what I mean? Like they're not marked.
Yes. Yeah. Well, that there's hope that once you find what those underlying root causes of the symptom of infertility is, that you can have success. We know that at this point, it's not 100%, right? But we have made a lot of strides in the area of infertility. And of course, as those of you who listen to our podcast, our paradigm comes from a much more restorative and a cooperative approach to women's bodies. So this is going to be our focus in this area of infertility is can we find the underlying root cause of someone's inability to conceive with their spouse? And can we help them naturally procreate? Because of course, we know every person, that's what they would like. The hope is that we can all be able to have biological children if we desire it in a natural way. So our goal is to help uncover some of these underlying issues. And where do I start in finding this root cause paradigm of infertility? So maybe we'll just start with just a general kind of summary of what infertility is, how it affects women, how many women it affects. Jamie, just kind of what do you know about that? And I can throw some things in too.
Sure. Yeah, well, I do know that 1 of every 8 couples will struggle with infertility. And just kind of on a related note, that 20% of pregnancies do end in miscarriage. So there is that heartbreak in that, but the very real numbers. And I'm honestly a little surprised that it's 1 of 8 and maybe not even more. And that might be more now. I remember when I was getting trained as a fertility care practitioner that, the instructors were sharing what our cycles look like now in relation to what the cycles look like in the 80s. And how the cycles now that women are experiencing are so much different. We think about textbook cycles where we have, the 5 to 7 day period, or the 4 to 7 day bleeding, which is the period. And then these days of dryness following with beautiful 5 to 8 day mucus, and then dry days following that, period starts again, normal cycle. But that's just not what cycles look like anymore, you know? And so yeah, it affects a lot more people than probably many realize.
Yeah, I mean, I was trying to look up some statistics on this, and 1 in 8 couples gets mentioned a lot. But I also, read that in developing countries, it's 1 in 4 couples. So I do think we're closing in sometimes on larger numbers, and there's also the knowledge that couples are waiting longer to have children. That people are on average 30 and older. And from my research, our actual fertility declines at 28. And I remember just telling a patient this week who, I think she was 32, and we were talking about how she was interested in potentially starting her family soon, but she was nervous about whether she would be able to come pregnant. And I was bridging that discussion with her about learning to chart her cycles. And when I told her that natural fertility declines actually significantly first at 28, her eyes kind of got big. But it is important. In fact, it was so important that women understood this age-related factor to fertility, that the March of Dimes it was years ago, probably 2010, 2011, actually put a national campaign out to the entire, United States to let women know that, we are on a biological clock with fertility, and that, they were encouraging people to understand that if you desire children, it is important to remember that your age is a factor. So first and foremost, that's kind of interesting and always important for us to remember. If you want a family, maybe waiting till, you're after 35 is certainly going to make it much, much harder.
Yeah, totally. And I do want the listeners, though, to know, so we have a broad range of ages who listen. So maybe you're earlier in your 20s and you're thinking, wow, I'm really glad Teresa said that, because I don't know if I would have thought that. But there's also going to be women who are 28, 29, 30, into their 30s and struggling so terribly to achieve pregnancy. So what we don't want is for you to hear that 28 number and think, oh my gosh, because truly, good sperm, good eggs, good mucus, you need them, you need all three, but we can kind of work through that angle. And again, if you're not charting your cycle, if you're listening and you're struggling with infertility, and I'm not going to go hardcore on this yet, this unexplained infertility, which is also a bit of a trigger word for me. But if you are not yet charting, let that be step number one. If you're going to get anything from this episode, if this is you, or if this is a mother listening and your daughter is struggling, or a sister or whatever, please know to find a fertility care practitioner or a femme provider. Go to managingyourfertility.com and find a fertility awareness instructor. It is different when you meet with somebody and work through this with them. It helps emotionally, right? We feel heard, and, we might cry a little, which is totally expected and it's totally fine, but we need that, especially with women, we need that. And then secondly, that information is going to be so much more revealing to you as a woman than charting on your phone or reading a book. I can't, Teresa, right? I mean, that's first step. Definitely.
No, it is. And it's hard for me because I'll see a patient and this is their issue they're coming to me with. And sometimes, they're looking at me like, what? You just told me that I'm going to start first with just charting. It can be kind of a little eye-opening for them. But you are so right. The first relationship you want to establish is with an amazing charting instructor from, many systems that we have now that are scientifically proven to help women with understanding their fertility. And it is a relationship, and that person is going to help you understand your body, and they're going to allow you to get accurate documentation of your cycle, which as a provider, then I use as a diagnostic tool. So it is, in this world where Jamie and I live in, learning to chart your cycles with a good charting instructor is the first step to understanding your fertility. And it is the most important step before really all others come.
Amen. Totally. And also having that community. So it's that information that the cycles, your body's telling you something. I always say our hormones have a voice. You know, our hormones have a voice, our body has a language. You know, what is your body trying to tell you? And sometimes the absence of noise is something enough. You know, the absence of that hormonal noise is information enough. So Teresa, what are some of the things that you've seen in some charting patterns as women are coming to you who struggle with infertility, that you notice that you want to share kind of right off the bat?
Mm-hmm. Yeah. So right off the bat, what I'll say is, you mentioned very simply that you need three things to be able to have a baby. You need a quality sperm that obviously comes from the man. You need a quality egg that comes from the woman. And you need this thing called cervical mucus, because as I like to say to my high school students, what does a sperm do? And they're all thinking about it. And they're like, okay, I think I want to say the word swim because they can see it. And they'll say, finally, someone will say swim. And I'll say, yes. And can you swim in a pool with no water? And then they're like, no, you can't swim in a pool with no water. So essentially, you have to have water for the sperm to get to the egg. And mucus is this watery substance that allows the sperm to travel all the way up into the fallopian tube, which is actually still kind of amazing to me, to get to that egg to be able to cause conception. So mucus is what we're looking for in these charts. And I am most familiar with the Creighton model system, obviously, and it is a mucus only system. Certainly there's other biological markers that you can track, but because of this essential ingredient to conception, it is very important to not discount this biological marker. And it's a need to understand if it's there, number one, because if it's absent, I can already look at a chart and say, holy Moses, we got a problem because we have no mucus, or we have 1 day of mucus and you only saw it one time a month, So that's a huge one. So we're looking at those mucus patterns. Is it abundant enough? Is it on enough days? And does it give evidence of the main event, of course, which is ovulation? And you got to ovulate to make a baby. So number two is whether or not we can establish a pattern of healthy ovulation. And obviously the biological marker of mucus tells us that. But whether or not someone has a period every month also tells us that, right? Because the period is just the after event of the main event, which is ovulation. And so if I see the normal progression of fertility, a period, a mucus patch, and a period again, we have at least some evidence that there is an ovulation event occurring. And then, if I see bleeding patterns that are abnormal, that's a big one in charting. Is there a lot of abnormal bleeding in the cycle? Is there spotting at the beginning of the period? Is there spotting that trails on for days at the end of the period? Is there spotting in the middle of the cycle? So those are right away things that you can look at that are very simple in the charting.
Yep. So man, oh man, it's such a beautiful gift that we have to be able to chart our cycle. So again, take that home with you. All right. So Teresa, you mentioned the men. How we need good sperm. And so often it does seem like when women are coming to me and couples are coming to me, it's not uncommon for the man to have gotten some sort of, testing to see what his sperm count was like, but it's not always the first case. Often it's the woman who typically assumes it's like her issue, and we know it's both of them. We need two people to have a baby. We need sperm and we need egg. So talk a little bit about that male component in your practice.
Well, yeah. And just statistically, actually, and you're right, Jamie, a lot of women have this sense that it must be them, because the woman carries the baby, right? So it must be my problem. But actually it's thought out to be in the pie of like what causes infertility, 30% to be a female factor, 30% to potentially be a male factor, and 20% to be, I think, a tubal or physical factor, and 10% to be unknown cause. I think that's how it is. But yeah. Or maybe it's 30% the combination of the both, 10% considered unknown. I think the 10% unknown, I feel like it's probably, most people would think it was higher than that, because a lot of people don't know why they can't get pregnant, at least from their subjective opinion. So for the male factor, yes, it's so important just to not discount that you got to test the male in terms of his semen. And we call that a complete semen analysis. And in my practice, and in a lot of the practices that I know of, we can do that without what most people would think, that you have to collect a semen sample in an act of masturbation, which actually you don't. So for those of you out there who are like, gosh, I just wish that didn't have to happen, you can collect a semen sample in an active intercourse, and there are labs that are ready and waiting to take that sample from you after you've collected it in an active intercourse. We use basically it's a medical grade condom to collect it, and it's put in a specimen cup, and I can get very accurate results on a semen sample. Any man who has less than 10 million sperm, but really less than 15, could be considered subfertile. And of course, we've mentioned this on our podcast before, that sperm counts have declined over the last 40 to 50 years significantly. And there's really kind of an unknown reason, although we can suspect it has something to do with stress, toxins, and endocrine system disruptors. So that is a concern. And so now it doesn't matter. We really got to know what's going on there. And there are other physical causes that men could have low sperm count. One would be a varicocele, which is kind of like a varicose vein. If you've heard of that in a woman, it's similar, where the vein kind of loses its tone and it can kind of pouch out. Sometimes it's referred to as a bag of worms in the testicles, which is really weird. But
oh my gosh, I hate that.
Yeah, but apparently that's what it feels like. I've never felt a varicocele, but that's important because it does disrupt kind of the pathway of sperm production. And there can be other kind of testicle injuries and things that hormonally are not right that prevent the production of sperm as well. So if you get a semen analysis and right off the bat, you're like, oh, we got a problem, then, we need to have a good male fertility doctor, like a urologist potentially, that can help at least just kind of sort through the main components. And then we can kind of work with that man's sperm count after that. Totally. So very important to get to the bottom of that as well.
Yeah, I was working with a couple where the husband had, like, genetically, it was like a subfertility something. We already knew he had an issue there. And then he had a varicocele vein. And then she had PCOS and endometriosis. But truly, by getting her cycle correct and addressing her issues, even though his sperm count, I think, Teresa, I'm going to say it was 500,000. It was ridiculous. Wow. Yep. Crazy miracle. They've had 2 children.
Wow.
Crazy. So anyway, his sperm count was extremely low, but it was really in targeting that woman's fertile window and getting her restored, to the point that she could ovulate, that it was just this beautiful miracle. Okay. But as I say that, I'm also realizing that can be triggering to hear that. What we don't want for you listeners who are struggling with infertility to think, but that won't be me. That won't be me. And so the thing is, we don't know, and you don't know. And what Teresa and I hope to do with this episode is comfort you, and to give you hope. Having a child, it's, again, a byproduct of, love and of fertility, right? But there are ways we can still be mothers. As women, we are maternal, whether we have a biological child or not, but there are ways that we can have a child who is biologically born of a woman who can't take care of that child through adoption. So I want to share a story with you, Teresa. I was working with this gal, and she was really struggling. This was probably about 5 or 6 years ago. And she was so and I can't imagine, I just can't. She was just so wrapped into the pain of this loss. Like it felt like a loss to her, even though she hadn't had a child that she lost. It's just the loss of this dream. She just never thought she would be able to have a child. And, she was never in prison. She never did drugs. She was happily married. And I looked at her and I said, this desire of your heart to be a mother is a great, beautiful desire. And you can be a mother. And for some reason, she forgot that she could be a mother. Like she just forgot. She thought, I will never hold a baby in my arms that I can call mine. And it was like when I said that to her, and I was nervous to say it. I didn't want to seem insensitive. But when I said it to her, she just started to bawl because she forgot. She was so wrapped into her own self-shaming, saying it's her issue, it's her fault. She's keeping her husband from having a child and from her family, from all these things. And she forgot she needed someone to say that to her. And guess what? She is a mother. It is actually to her a biological baby, which was a beautiful miracle. But even if it wasn't, she would still be a mother. We can still be mothers. And again, there's all these barriers that might come in the way of that. But don't forget that, women, if you're listening and there's that pain.
Yeah, that's really beautiful, Jamie. And it makes me think of, I know in naprotechnology, which is the science that we talk about on this podcast that has to do with finding the underlying root cause of infertility. And it stands for natural procreative technology. I know their ability to help women with infertility is really amazing. It's, 60 to 80%. But they also talk about a kind of like an expanded view of that, which is what we say is family building. And so if a woman isn't able to have a biological child, they do whatever they can to help her find family building, and that could be that conversation that you're talking about with, helping a mother see that she can still be maternal, that she has this gift of spiritual motherhood. She can mother to so many other people around here, but it may open the pathway towards adoption as well, or fostering. And it is difficult, like you said, Jamie, because when a woman wants a biological child, they want that more than everything. And I've worked with hundreds of infertility couples, so I know that deeply in my soul. But over time, when life continues to go on, what I always say is open your heart. Just ask yourself, like, can you open a door? Maybe a crack. Can you open it just a crack? Just to see, because people are afraid, like if they open the door towards adoption, that they've closed the door on the other thing. And that is not, I try to help people to see that's not exactly how it is. If you crack open your heart towards fostering or adoption, that's all you're doing. You're giving it a little door open, and maybe that door will bust wide open for you. Right. Who knows? Yeah. But if you don't let that door crack open a little bit to see, then you never know what potentially is waiting for you there. And so that's, it's something I'm really passionate about, like just helping people discern and come to peace no matter what. And it can be hard, and it can be hard to know what to say. Especially if you haven't struggled with infertility, which I haven't either, Jamie. And, but I just, like you said, we just really want to comfort people that, we have so much care and compassion and desire to just share with you whatever hope we can in this area.
Totally. Okay. So let's kind of work through, some of the causes of infertility. So earlier on, I said I don't like the words like I have infertility, because I know it's not true. Like it's the symptom of an underlying issue. And then also I had said that it's a little bit of a trigger when I hear unexplained infertility. And the reason for that is because it's kind of like that whole IBS thing, Teresa, but not. Yeah. It's like, oh, the thing you don't know what to do with it, I'm just going to say it's IBS, for your gut. Well, I'm just going to say as a doctor, because I don't know, it's unexplained infertility. And while that still might be a thing, because sometimes it's really hard to uncover why it's unexplained, the number of women though that come to me was above that 10% number. Like it was almost like everyone came to me with unexplained infertility, which is why they came to me. So it was either like most people who struggled would go either to get their IVF, or they'd come to me, before they go to IVF. You know what I'm saying? Yep. And so those women already felt like they already turned every stone. They already felt like, oh, there's not a diagnosis because my doctor did all these tests. That's why it's a trigger word for me, not because there are cases where people it's a journey and trying to figure it out. So here's the thing that I've learned. A large number of those women who would come to me with unexplained infertility, it was because of a progesterone issue that we were able to find out later. And it was from the lack of proper testing, like the wrong days that labs were being taken, that they were told wrong information about their progesterone levels. And so maybe they were told, their progesterone levels are normal. They come to me, what are you here for? Oh, I'm having a hard time, unexplained infertility. And I'm like, what day did you get progesterone? Yeah. What day? Day 21. I'm like, okay, that's where we're starting. So Teresa, will you share a little bit with our listeners, like why that would be a trigger for us, and something that can be very easily addressed, honestly.
Yeah. So, I mean, you could say, divide it up simply with hormonal issues versus organic issues and physical issues, which we'll talk about later. But from this hormonal standpoint, it's obviously linked directly towards ovulation, because again, it's if you're in a normal menstrual cycle, that ovulation event is what's creating all the normal hormones associated with fertility. So like Jamie said, you can't just do a day 21 progesterone, obviously, because not all women ovulate on day 14, which that is under that assumption. But this is why you need the charting, first and foremost, to be able to identify what the cycle parameters are for that individual woman in each and every cycle, to be able to do a thorough hormonal evaluation. And we're talking thorough. So the difference between a cooperative approach to understanding fertility and a root cause approach versus a kind of like, we'll do a bunch of like tests on one day and then call it good. That's what I kind of see on the other end of it. Is that we are going to literally walk through the menstrual cycle with estrogen and progesterone levels and be able to see exactly if those hormones are normal every step of the way in the menstrual cycle. And that is completely different and amazing to be able to see the results. So not only can I tell if someone's progesterone is low, which is obviously important, but I can find out if the progesterone is not only low, but dies early. Like if it's a short luteal phase or short post-peak phase. I can also see if the estrogen levels are low. So it's such an important thing, in the cycle as well. So it's the charting and a thorough hormone profile from before ovulation all the way through that luteal phase that is the most accurate when assessing fertility.
Yes. And so I do want to also, to our listeners, just know that if you're like, I'm struggling with infertility and the doctor says everything's fine, but we're still not getting pregnant, well, just know that there could be something, more we can do to understand your true hormone levels. But I also want to say that also, while we know it takes two to tango, right? We know like egg and sperm, mucus, all of it should in theory result in a baby, right? So we are checking our labs, and truly, let's just say our labs look pretty good. We know we're ovulating. We know we have open fallopian tubes. We know the man's sperm count's great. We're ovulating. We have our period. Nothing seems to be off. Well, the first thing I would say is check your stress. But the second thing I'd say is there's actually a third component. There's this idea that, there are things out of our control that have a play in this story of life. And in my belief, the Lord, in my belief, God is the author of life. And so while I might personally desire a baby right now, and while my husband might very much desire a baby right now, and there may be nothing seemingly wrong, personally, again, I believe very strongly in divine timing. I do believe that God teaches us things. He teaches us how to be patient. And I know that, when something is very difficult and hard, that we gain endurance through that time. And that endurance is never wasted. We need that endurance for something that we don't even know we're going to need it for. And we're going to be so thankful to have it. And so just know, if you are struggling, again, this is hopefully of comfort to you if you can relate to me in this way. But we want to control this. And in this society, it probably makes it even harder. Although I'm sure since the dawn of man, not having a child when we want to have the child's always been difficult. But just even now with social media, seeing people, hearing people just delight in their newborn and delight in their family can be so extremely piercing. But know that this time that is so hard for you, there is going to be fruit from it. And if you can think through that and how you're going to be stronger for something in the future that you're going to need to be strong for, to me, I would find that comforting, I think. And I don't know, Teresa, if you have anything else you want to share on that front.
No, I mean, it's great. I mean, obviously we're mind, body, and soul. So this is that spiritual aspect that all of us have, no matter what kind of faith background we come from, we have that spiritual aspect. And it's important to get in touch with it. And it's also important to see that, this is a great gift that's given to us, and being able to bear children, that women have this great gift. And, sometimes like you said, the gift giver isn't ready to give it. And it's the timing isn't right there. So It's just something where we all need support around that, and we need to be able to share too. I think this is a common frustration, that there just isn't a lot of places where people can share their pain with infertility, and to be able to share kind of those deep personal kind of beliefs and emotions and where they're coming from. So just know that you do need to find a place that's safe and supportive to be able to share those things. And it's really beautiful. I know there are some new programs that have been developed to help. And if you know of any programs and support groups for couples with infertility that you think are amazing, email us and let us know. We can share that with our listeners as well.
Yeah. I know Organic Conceptions is one.
Yeah, I definitely have heard of that one too.
Yeah. Well, Teresa, do you have any other last things here before I kind of recap what?
We talked about the hormones, but there is that physical aspect that's so important too. Because it is, for me, Jamie, like in practice for many years, treating couples, so many times, like you said, I've got the hormones right. I've got my ovulation sticks. They're working. They're telling me I'm ovulating. They did that procedure where they, checked my tubes and my tubes were clear. My husband's sperm is okay. And I'm still not getting pregnant. And I would say the missing disease, the one thing that often is missed is like what's going on in the pelvis and abdomen that your doctor isn't seeing. So the big one is endometriosis. It's also scar tissue and other tubal issues. And if you don't have a diagnostic laparoscopy, which is a surgical procedure done where a camera goes through your belly button to look inside your reproductive system, that can miss a lot of things. And you can listen to our episode on endometriosis. It was in season 1 to tell you how important it is to know about this disease, because it creates such a toxicity in the reproductive environment. And I would say it's certainly in my practice, and I know this isn't the stats that you will see often mentioned in terms of endometriosis and infertility, but it at least is over 50%. And my guess is that, it could be even higher in terms of those couples who have seen, all of the other problems addressed and still can't get pregnant. It's definitely got to be high in terms of that suspicion towards looking for endometriosis, whether you have pain or the typical symptoms of endometriosis or not. I just want you to know that is so important, because I've seen it so many times that was the missing link.
What is the reoccurrence rate? And I know there's 2 different types of removing, maybe more than 2, like the endometriosis. There's excision and there is like lasering it off and those sorts of things. So do you want to just real quick just share like what are the 2 different things that women are going to hear in terms of removing?
Well, again, it's most important to know that you have a surgeon who understands endometriosis, and their intention is to know how to cure it at 100%. Because if they don't have that intention and they're like, well, we're going to get in there, we got what we could. I often hear that. That's not the right doctor if they're just going to get what they can. Excision is the gold standard. Excision means that they actually, whether it be with a cutting tool or a laser, actually remove the tissue from its kind of full source underneath to remove all of that lesion. Lasers can be used too for smaller implants that are more surface level. And again, you have to have a trained surgeon that understands the disease to know what really should be used with a laser only versus excisional removal. And you have to have a trained surgeon that knows how to correct and repair those tissues so they don't cause scar tissue for that patient going down the road in the future. And reoccurrence rates, if a surgeon is really well trained, are low. They're somewhere between 10 and 15%. But if a surgeon is not well trained and doesn't do a thorough job and leaves kind of a half job, then the reoccurrence rate is basically 100%, because they never removed it 100% to begin with. And so when someone tells me that they already know they have endometriosis, they have infertility, they had it treated by a doctor, I ask a lot of questions about how that surgery was done. And if I hear the word cautery, I'm very concerned. If I hear a phrase like, well, they told me they got what they could, I'm very concerned. If I hear that they had moderate to severe endometriosis and someone only used a laparoscope and treated it that way, I get very concerned, because that means the likelihood of them getting a cure for that disease goes down dramatically. And so, this is, we could talk about this a really long time. If you have questions or concerns, or you want to know where a doctor that is trained I mean, there is a list of surgeons that you can get from the St. Paul VI Institute, or if you go to fertilitycare.org, there's a list of doctors there. But there are only very specific ones that are trained well in removal of endometriosis. I know there's a big organization called Endometriosis Care, endometriosis.org too, where they have, I think it's in Atlanta, Georgia, that they are specialized in it. So not all OBGYNs are trained well in this, unfortunately, but really important.
Yeah, definitely, Teresa. Well, I'm glad you mentioned that because that's super important. Do you want to real quick before we wrap up talk about like pelvic floor stuff, pelvic floor professionals?
This is an exploding area of my use in practice. And I think just, the understanding of how important the pelvic floor is in relationship to blood flow and adhesions and pain, chronic pain, pelvic pain. So certainly anybody who's had a previous pelvic abdominal surgery, a pelvic floor therapist could be really helpful. If you have chronic back pain, or if you have issues with incontinence or pain with intercourse, there are so many reasons why a pelvic floor therapist could be utilized to assess deeper what's going on in terms of that pelvic floor, and to really strengthen and provide literally kind of like reset the anatomy in the right way for the pelvic floor. And it's great because I do know we got to have a good pelvic floor therapist to interview here on the podcast. We will do that down the road, because this is, like I said, kind of become a very exploding area where people are being sent to pelvic floor therapists and being utilizing that therapeutic treatment it's really creating amazing results for patients. And I've seen that with endometriosis, and I've seen it with pelvic floor issues, incontinence, all sorts of things. So there's not a lot of statistics in its relationship probably to infertility and the success it may have therapeutically for that, but I would not be surprised if there is research brewing in that area.
Oh man, so awesome. So awesome. Thank you so much, Teresa, for that information. I felt like I even learned a lot in this episode. Teresa, to our listeners, again, do not lose hope. And Organic Conceptions, look into that program. If any of our listeners, again, have some support organizations they want to provide, please send that our way, and we'll do our best to make that known to everybody. And just keep on being an advocate for your health. If you're not charting already, please start. If you don't have a medical provider who seems maybe like the right fit, just do some interviews and start there.
Yeah. And you can check out naprotechnology.com for more information. I know we use that phrase. That is a pathway to help for natural procreative care. There's also many others out there doing cooperative and restorative infertility care too, but naprotechnology.com, that is a great place to start.